Hello everyone. Intravenous access. How important in-fore access for patients and nurses. How to find a good peripheral vein for fore insertion and blood works. Are you one of these people who asks the questions above? By any chance, did you have doubts and wonder how? Maybe questions comes in your head of how nurses do that task. What I am about to share here is my own personal technique and experiences. Nursing skills that I learned and developed in my years of nursing career. These skills and assessment are effective and simple. We all know that nurses are the last advocate and defense layer of patients. Nurses try to do excellent bedside care most of the time. However, there were moments that nurses feel like they are failing their clients. One of the most common frustrations in the bedside care is finding a good vein to insert intravenous access, or for short known as fore access. What is intravenous access? Intravenous or fore access is a direct access created by placing and inserting cannula inside a superficial vein. It creates an open and direct tap to patient's vein. It prevents the patients from being poked by needles multiple times and allows blood works and sample collections, administration of blood products, medications, and fore fluids. Needles may be small, but many people are scared of it. Am I correct? Even people who works in a medical field gets nervous seeing a needle. Perhaps a human instinct and being afraid of pain. Seeing a needle makes your mind anticipate pain, resulting to fear. Also, the reality is, not everyone can insert fore access one time. There are occasions that patients being poked multiple times because of their medical conditions. Patients who have cancers, dehydrated, kidney failure, and more are some of the challenging people to place in intravenous access. It is known as difficult stick for nurses. For you, or a nurse, to insert and establish a good peripheral fore access, you need to first identify a good vein. Using a device called Vein Finder can help in illuminating good veins. https://amazon.de/3rdggsm. Peripheral is a medical term referring to patients' extremities such as arms and legs. It is my practice to start placement away from the patient's center body. For adult, I looked for veins in the back of both hand and slowly move into upper directions. If I do not find anything in the upper extremities, I start looking in the lower extremities. However, placing cannula in lower extremities are not ideal because it affects the ability of the patient to ambulate. For infants and neonate, antecubital area and lower extremities are good placement area. In some difficult stick cases, veins are visible in the scalp, underarm, axillary, and abdomen. For blood works collection, the heel of the foot is always the first choice. It is my practice to apply warm packs for a few minutes to the area I identified as good vein before puncturing the site. The warm pack dilates the vein and promotes blood circulation better from what I observed. 5 major characteristics of a good vein for fore placements. Straight. Big and embossed. 3. Away from joints or bendable body parts. Non-movable vein. If no other choices, movable big veins are usable but requires good control of the vein when inserting the angiograph or fore cannula. For dark-skinned patients, Feel the vein for a good pulsation. Possible blind shot insertion. The term blind shot insertion means the nurse placing a needle to a vein that he or she cannot see but can feel. This is a situation that needs a nurse who are seasoned and have strong assessment skills. The patient's pulse guides the trajectory of the needle. In order for the nurses to save the lives of these patients, all possible and safe way of finding a vein is a must. Again, using a device known as vein finder can help to illuminate good veins. The above vein characteristics are vital to successfully insert in 4 cannula in a single attempt. Practice, patience and confidence will help you develop your nursing skills eventually. Disinfecting skin for blood works collection, intravenous access insertion. Now, I will share some tips on how to improve your nursing practice and make awareness of what is correct or what is wrong in the process of blood collection. First, let me ask you a simple question. When you visit your doctor's clinic for annual checkup and needs to do your blood work, do you observe the staff who is preparing to collect your blood samples? Maybe some are not because they are more anxious with a needle. Right? Let's face it, many people are afraid of needle. In the other hand, some patients may be observing the staff or phlebotomist doing it, but do they know what is correct and what is wrong on their observation? Now, let's find out below. The following basic sanitation needs to occur before the nurse or phlebotomist punctures your skin with a needle. 1. Introduce themselves by stating their name and explaining briefly what they will do. Wash their hands in a running water for 15 seconds or more. Identify you by asking your name and medical record number. Prepare all they need to use in order to collect your blood, such as vacutainers, butterfly tape, tourniquet, small gauze, and disinfecting alcohol swab or chlorhexidine. If the staff or phlebotomist uses chlorhexidine, it is quick and fast. The staff can wipe and disinfect your skin by rubbing the chlorhexidine swab or cartridge any direction back and forth for 1 minute. https://amazon.to/48bd2bm. Many hospitals and clinic prefer to use this product. A bit expensive but highly effective and safe. If the staff or phlebotomist uses traditional alcohol swab to prepare your skin before puncturing, then you must observe the following steps below. These steps need to be followed accordingly to achieve the highest quality of skin disinfection. Wear appropriate personal protective equipment like gloves. Tear the alcohol swab cover and pull out the swab. Wipe and scrub your skin using a single stroke from inner to outer circle. Wait until the alcohol fully dries. Puncture the skin for blood collection. The alcohol needs to dry completely for 2 to 4 minutes. An inaccurate result of blood glucose level may be obtained if alcohol is not completely dry prior to puncturing the patient's skin and collecting blood sample. Observe and make sure that any possible cause of infection can be prevented. Guard yourselves and stay healthy. I hope you enjoyed this blog. I highly appreciate your time and comments. Kindly support my channel. Please like and subscribe below.